Namaskar Qureshi. Today I am going to be presenting non-invasive sensing of anemia using a low-cost and portable millimeter-wave resonator. Anemia is caused by the healthy red blood cells or the hemoglobin levels, which help the body tissues to carry out their works. Anemia affects the immunity, and in one study, it was also found that it is also associated with COVID-19. Those with the high risk of anemia are normally not diagnosed timely, as it requires very expensive and invasive complete blood count test. Therefore, we have presented a anemia diagnosing tool which is based on the resonator. Our resonator sensor design is based on the two layers. The first substrate or the first layer consists of the transmission line, which is supposed to be connected by a vector network analyzer. On the top of the first substrate, we have the second substrate, which consists of the resonator, and the resonator is supposed to be covered by the blood sample. Since we have presented a resonator design which can detect the changes in permittivity, so if we wish to investigate the blood and we want to correlate it with the reduction in hemoglobin levels, which is about the existence of anemia in blood. So we can see from these figures that real permittivity and imaginary permittivity increase as the hemoglobin levels reduce. So we can use these data in our sensor to detect or investigate the performance of our sensor design. The responses of the reflection coefficient of our sensor design, where we varied the hemoglobin levels of the blood sample, we found out as the hemoglobin levels decrease, the resonance is shifting towards the higher frequencies from 26 GHz to 27 GHz. In addition, we can also observe the changes in the sharpness of the resonance when there is decrease in the hemoglobin levels. Using the resonance shift as well as the sharpness, or we can say the Q factor of the resonances, we can obtain the associated, or we can correlate it with the estimated hemoglobin levels of the blood sample. As we can clearly see from the figure that the hemoglobin levels for the males are ranging from 13.5 to 17.5, and for females they are between 12.0 to 15.5. So using the F or resonant frequency or Q factor, we can estimate the associated hemoglobin levels from these parameters. Our product works in such a way that the resonator is connected by the vector network analyzer, and on top of the first substrate we insert the second substrate, which is replaceable for every measurement, and we insert the blood sample on the surface of the resonator. Later we can clearly see the responses on the VNA, using which we can associate it with the or correlate it with the hemoglobin levels of the blood. As in our sensor, we only need a small amount of the blood which we can extract from the finger using the finger prick technology, and we only have to introduce the blood sample on the surface of the resonator. Later we can clearly observe the responses on the VNA, and in this way we can test the blood for anemia in non-invasive way, and it is also quick and easy as well as efficient. So our sensor is also portable, we can use it anywhere anytime. It can also be used in case of an emergency, so the overall cost of the sensor is also reduced, and we can use it very efficiently. These are the references and publications we have done so far. This is all from me. Thank you very much.